Rhosgobel rabbit ASMR. Relax. Hello and welcome. Today I understand that you're here for your cranial nerve examination. Is that correct? Good, very good. Yes, these things can be a bit repetitive, but when you work for Shield, you are required to have your examinations done every 6 weeks. And from what I understand, you are a new patient of mine, so perhaps it will be a new experience for you. Yes, shall we get started? Well, since every doctor is different, I'm going to explain each step of the procedure for you as I'm doing it. That way you feel very comfortable and relaxed, because throughout the examination I will be testing your reaction and reflexes to different stimuli. I will need to speak very softly and calmly so as not to interfere with the examination. Okay? Very good. Alright. Well, I just put on my gloves, and the very first part of the examination is just a simple once-over, if you will. I just need to make sure that there are no lesions, bug bites, implants, or anything of that nature. Anything that could interfere with the examination. Okay. Alright. So I'll just start with the skin on your face. I'll work around your ears. And then I'll take a flashlight, look at your eyes, inside your ears for signs of infection. And then I'll just quickly go over your scalp. Okay? Very good. Just hold still. Just looking over your face. Making sure everything is in order. Looks good. Okay, I'm going to look at this ear. Make sure behind the ear looks okay. That looks good. Let me check your other ear. Okay. Looks good over here. Okay. Alright. Now I've got my flashlight, and I'm not doing the eye exam just yet. I'm just checking for signs of infection, swelling, anything of that nature. So if you could just look to the center of my face and just hold very still. This will only take a moment. Okay. Alright. Looks very good. Okay. Alright. You're doing great. Let me just have a look inside your ears. And here we go. Very good. Just go over to this side. Have a look inside this ear. Looks good. Okay. And be using this tool just to go through and examine your scalp. Alright? Just hold still. I'm just going to be working my way all over your scalp just to make sure that there are no lesions, implants, mind control devices, bug bites. Looking good so far. Alright, well, everything seems to be in order, and I think we are ready to proceed with the examination. Just take my gloves off. Alright, well, the first part of the examination is going to be testing your hearing. And this is not a comprehensive hearing examination. What this is testing the cranial nerves that pertain to your hearing synchronization, so on and so forth. So, what I'll be doing first is I'll be taking a headset, putting it on you, and then you will hear a series of tones randomly into each ear. When you hear a tone in your right ear, I need you to raise your right hand. When you hear a tone in your left ear, I need you to raise your left hand. So on and so forth. Okay. Alright. Go ahead and place the headset onto you. Going to turn on the device over here. Okay. Very good. You're doing really well. Excellent. Very good. Excellent. All right. Okay. I'm going to just turn off the device and remove the headset. Alright, you did very well. So, for the next part of the examination, I'm going to be placing a cotton ball into one of your ears, and then I'm going to go to the other ear and whisper very softly a series of words. And if you can, I would like you to repeat those words for me once I ask you to do so. Okay? Alright. So just relax as I place the cotton into your ear. Alright. Is that comfortable? Okay, excellent. Now, I'm going to go to this ear and I'm going to whisper a series of words. Okay. Apple. Red. Now, are you able to repeat those words back to me? Excellent. Very good. Let me just remove the cotton. Okay, there we go. I'll be getting a fresh piece of cotton, and I'll be placing this piece of cotton into this ear, and then once again repeating the process. Okay, all right. Okay, there we go. All right. Are you comfortable? Excellent. All right, here we go. Light bulb, chicken, 72, lollipop, and are you able to repeat the words back to me? Very good, very good. You're doing great. Let me just remove the cotton. There we go. Excellent. Now, you did very good. So, the next part of the examination is quite simple. I need to test your swallowing reflexes, and then I'll need to have a look inside your mouth at your throat. So, what I'll be doing is I'll be giving you a sip of ice water, and I'll be placing my hand very gently on your throat. No pressure at all, just barely touching the skin. And I'll be feeling for any signs of distress or anything abnormal. Okay, so I have here the ice water. Go ahead and have a sip. All right. Excellent. Now just I want you to open your mouth, stick out your tongue so I can see the back of your throat, just like this. Very good. Let me just have a look. Okay. All right. Everything looks good. All right. You are doing great. Now, the next part of the examination will be testing your eyesight and how you respond to different stimuli. So, for this part of the examination, what I'll be doing first is asking you to cover one of your eyes, and then I'll be testing the other eye and how you respond to different ranges of motion and stimuli. Okay. The first thing I'm going to do is have you cover your right eye, and I'll be testing your left. And I'm going to ask you to follow this light as I move it around. Okay. All right. So go ahead and cover this eye. Like so. Very good. And just follow the light for as long as it is in your field of vision. Very good. All Now I'm going to go vertical. And once again, just follow the light for as long as it is in your field of vision. You're doing really good. I'm going to make a few circles. Excellent. You're doing great. Let's speed up just a touch. Alright. Very good. Okay. Now, if you will, go ahead and cover this eye and follow the exact same process. Follow the light for as long as it is in your field of vision. A little bit lower. Very good. Excellent. Okay. Now I'm going to go vertical. Continue to follow it for as long as it is in your field of vision. Very good. Now I'm going to make some circles. Very good. Very good. I'm going to speed up a touch. You're doing great. All right. Very good. Well, you're doing great so far. Now, once again, I'm going to need you to cover up this eye. And I'm going to ask you to follow my fingers this time. Okay? So go ahead. Cover it up. Very good. And just follow my fingers for as long as they are in your field of vision. Excellent. You're doing really good. Now I'm going to go vertical. Follow my fingertips for as long as they are in your field of vision. Now I'm going to make a few circles. Alright. Excellent. I'm going to speed it up a touch. You're doing great. Okay. Now we'll try the other eye. So go ahead and cover this one. Very good. And with your other eye, I'll need you to follow my fingertips for as long as they are in your field of vision. Very good. Alright. Now I'm going to go vertical. Just continue to follow my fingertips. Alright. Very good. I'm going to make a few circles. Excellent. And I'm just going to speed it up a touch. Alright. You are doing great. Very good. Alright. I'll need you to cover up this eye again. And then I'm going to ask you to follow my fingertips once again. But this time, I'm going to add a little bit of movement and sound. Okay. Now, see if you can follow. Very good. I understand if it's a little bit more difficult to concentrate. That's perfectly normal. But still be able to complete the task. Very good. And I hope you don't mind the birds chirping outside. They seem highly interested in your examination. Go ahead and cover up this eye. Very good. And we'll do the same thing. Just follow. It's perfectly normal if it's a little bit more difficult to concentrate. Don't worry about that. Just complete the task. Okay, some circles. All right. Very good, very good. You're doing really wonderful. Very good. Well, the next part of the examination will pertain to touch. I will be touching your skin, your face, your ears, and your neck with two different objects. One of them will feel cold and one of them will feel warm. And I'll need you to distinct between the two temperatures and let me know if you get them mixed up or anything of that nature. Sound good? All right. The first object is this chilled metal spoon. And what I'll be doing is dragging it across your skin in different areas of your face, your ears, and your neck. It should feel cool to the touch, and if it feels warm to the touch, or you feel anything out of the ordinary, please be sure to let me know. Okay? I'm just going to drag it across your forehead. Very good. Did you feel that? Excellent. Let's go to your cheek. Very good. Everything good so far? Excellent. And your other cheek. Excellent. And your neck. Alright. Everything normal so far? Excellent. And I'm just going to drag it across your earlobe. Alright. Everything good so far? Should feel cold to the touch. Alright. Everything perfectly normal? Any numbness, heat, anything like that? Okay, excellent. Now, the second object will be my hand. And my hand is warm. And I'm just going to drag it across your skin. And if it feels cold to the touch, or you feel any numbness, burning, or anything like that, please let me know. I'm just going to drag it very gently across your forehead. And then down your cheek. And your other cheek. Then down your neck. Everything good so far? Excellent. Across your ears. And down your other ear. anything feel cold or numb or anything of that nature? Excellent. Well, you're doing great so far. The next skin test I have for you, I have here a metal instrument, and what I'll be doing with it is very gently scraping it across your skin in the exact same areas that I previously touched. And this will not be painful whatsoever, but what it will do is let me know if there's any signs of overstimulation or understimulation. So for example, the area that is scraped should become slightly red, but if it becomes extremely red or doesn't react at all, that's something we should look into. Okay, so just hold still. Forehead. Now I'm going to go down your cheek. Okay, that cheek first, then this cheek. Okay, then your ears. Very good. Your other ear. Alright. Did you feel any sensations of numbness or pain? No, I didn't expect you would. You're doing great, thank you. Okay, now, the next part of the examination will be to test your response to scent. I will be holding up a series of essential oils and asking you what smell you smell. The goal here is not to worry about getting the answer 100% correct. Just tell me what's honestly on your mind. I'm just looking for any sort of distortions of smells or anything like that. For example, if you smell anything that smells like ammonia or copper, that's something that we would want to look into. Okay, very good. So, and all of these oils are very pleasant, so don't worry about that. Okay, if you're the first one, let me just. Alright, have a smell. And what do you smell? Excellent. Very good. It was lemongrass. And you chose lemon, so you did very well. Let me go ahead and get the other one. Okay, let me just open this up. Have a smell. Very good, very good. You're actually quite talented. That one is grapefruit. Some people will often say orange or lemon again, but it is in fact grapefruit, so you must have a very good sense of smell. Okay. This one is a bit on the tricky side. Oh, well. Yes, they often wear this scent, but this one is called patchouli. And I would definitely take your answer as correct. Now one more. Let me just grab it. Just open this up. Very good. That one is, in fact, cinnamon. You did excellent, and you have a very good sense of smell. Okay. Now, for the next part of the examination, I'm just going to need to test your strength a bit. And I'm not looking for any Hulk-like strength here. I'm just wanting to test for any obvious signs of weakness that would be disproportionate. Okay, so what I'm going to do is I'm going to place my hand on the sides of your head, and then I'm going to ask you to turn and then turn again. And what I'm going to do is I'm going to add some resistance with my hands. And I just want you to fight my hands and see how far you can turn with me adding resistance. Okay. Now go ahead and turn. Very good. Very good. You did an excellent job. Now, I'm going to place my hands on your shoulders, and I'm going to press down and add resistance. What I would like you to do is raise your shoulders against my hands. So, let's see here. And up. Very good, very good. Now one more. I'm going to once again place my hands on the sides of your head, and I'm going to ask you to turn this way and this way. Not like this, but like this. Okay, of course, you'll be fighting my hands. Turn. Very good. And try again. Very good. Excellent. Nothing out of there. Well, it seems you have passed all parts of the examination with flying colors. So, if you're ready, you can step into the next room and you'll receive your comprehensive eye exam, hearing examination, and blood work. Very good. I'm very happy with your results. Okay. Thank you for coming in, and I hope to see you